depression is one of the more common comorbidities or problems that have been associated with diabetes. And we don't exactly understand the biology of how this happens, but we know that people with all types of diabetes are at increased risk of depression. We also know that depression significantly gets in the way of taking care of diabetes, i.e. I don't care, I'm depressed, I don't feel like checking my blood sugar, I'm not going to do it. We also know that poorly controlled diabetes increases your risk of depression, so that you kind of get in this very vicious itch, scratch, itch cycle where you're not taking, you get depressed, you don't take very good care of your diabetes control gets worse, therefore you feel worse, therefore you take less care of your diabetes, therefore you feel worse, therefore you take less care of your diabetes, therefore you feel worse. For parents who have children with diabetes, I think that we always try to make them, number one, aware that the child is at some increased risk of depression. Secondly, we try to make them aware that there are a number of medications that are quite effective at relieving depression. But we also talk to families about how depression shows up in children, what sort of things you might see. So it may be withdrawal from friends, it might be unusual changes in behavior. So a child that used to be really peppy, who's now just kind of dragging all the time and there's no physical reason. That it might be, in boys, sometimes depression shows up as just increased aggression and anger and frustration. And we always tell them, listen, you know, we have people on our team that are good at diagnosing depression and good at helping children and their parents deal with the depression. So just kind of be aware that it's at risk, and if you start noticing, don't let it go too far without mentioning it to somebody so that we can intervene. Because we also know that the earlier you intervene in people with depression, the greater the likelihood you're going to have a good outcome.